So, Dr. Sapp, this was a question actually from some of the West folks. Will you talk about how do you tell if someone is struggling with depression? And will you also speak to us about, all of you, speak to us about the issue of clinical depression? I think I've heard from people that when they have found that they are clinically depressed, people will say to them, well, just snap out of it. You know, this is not as bad as you think it is. You know, you just need some rest or blah, blah, blah. And that they glaze over it. And clinical depression and depression is real. So would you guys speak to that, starting with Dr. Sapp?
Sure. So there is a book called the DSM-5 that lists, we use it as a diagnostic manual, and to diagnose clinical depression, there's a series of clusters of symptoms that if you check enough of these boxes over at least a 2-week period of time, then you are clinically depressed. So let me just tell you what some of those symptoms are. When someone comes into me and they report that they're sad, that they're tearful more than they would be. They've also perhaps lost interest in activities that they usually like to do. Maybe they like to hang out at football games with their friends, but now they could take it or leave it. Maybe they're not as interested in their schoolwork. Lost concentration. They try to do their schoolwork, but they really can't focus, or they can't make decisions on how to prioritize their time. They, a lot of times, have disruptions in their sleep. You saw that in the video, and that can go one way or the other. They either, they've got thoughts running through their head, and they can't sleep no matter how hard they try, or they fall asleep and they can't stay asleep. Or it could go the other way, and they're sleeping 10 to 12 hours a day. They can't get up out of bed. They're tired. They don't feel refreshed when they get up. Same with appetite, changes in appetite. Maybe they're not eating and you notice that they're losing weight, or it could go the other way and they're headed for the comfort food and you see their weight going up. Or they're preoccupied with death, or they're talking about death, and not fear of dying, but talking about not wanting to be here, talking about being lonely, talking about feeling hopeless. Maybe they're really fatigued. Then you really get a sense of the pain, the emotional pain that they're going through. So those are some of the clusters of the symptoms that we look for. And then in terms of how that translates into how we look for suicide, you can look for, you want to be aware of some of these symptoms, and what you would notice is, gosh, there's something different with my friend. They're not quite the same that they were before. They used to be outgoing, and now they're withdrawn. Perhaps they took great care in their appearance, and now they just kind of look disheveled. Again, they may be preoccupied with death. They're writing poems about death. They're writing letters, or maybe some of their essays to teachers seem really, really, really dark. They could be more easily agitated, particularly in teens. So those are just some of the things. And if you notice that something is off, and I think Ash is going to speak to this. I mean, you want to reach out, you want to engage, you want to be that person to connect and offer hope. And there's questions you can ask and things that you can do for that. But those are some of the main clusters. And if they are talking about wanting to die and not wanting to go on, stop the show. Then you want to stop right there and ask questions, and we've got to get them to help immediately. And there's a difference, and we'll speak to this in a minute, in terms of whether someone is saying, I don't want to live anymore, to I really don't want to live, and here's how I've thought about killing myself, and oh, by the way, I have this razor or these pills, and oh, by the way, this is when I'm thinking about doing it. I mean, the lethality increases as you move along that continuum. And a lot of people who attempt and experience death by suicide are suffering from clinical depression, so we want to be aware of that.
Do you have anything to add?
The only thing that I would add, that's obviously a very comprehensive list of symptoms, and Dr. Sapp is right, those all come out of the DSM-5, but with teens, and she spoke to this just a little bit, sometimes it looks a little bit different. With teenagers, a lot of times they're more angry. They're spending more time alone in their room, which is a little hard for those of us to gauge who have 15, 16, 17-year-olds, because they're always in their room. But you know, maybe it's hard to get them to come out. They're just not interacting nearly as much. Maybe they are doing some self-injury, some cutting. Maybe they're using drugs or alcohol to numb the pain. So those are some of the other things I think that we look for, particularly in teenagers.
Comment I would probably want to make is as a psychiatrist, I'm also a physician and a medical doctor. So I tend to also medicalize mental health. I liked the video. It certainly does not discriminate, and that is to say there were all sorts of different ethnicities that were portrayed in that video. So whether it's socioeconomic status, depression and other mental health issues does not discriminate. The incidence of depression and schizophrenia and other mental health problems is really the same in virtually every country. When I look at depression and clinical depression, everybody has a right to be sad. Everybody has a right to feel grief. Everyone has a right to be unhappy because things aren't going their way. But there's a big difference between depression rather clinical depression and sadness or unhappiness. There are psychological, but there are also biological factors of depression. And that is to say, our brain is an organ in our body, and it does have a specific job to do. When our brain is not functioning correctly, just like any other organ in our body, if it's your pancreas that isn't balanced correctly, then a person has blood sugars that are out of control, and that is called diabetes. However, when it's our brain that's out of order, a person can suffer from dementia, Parkinson's disease, depression, anxiety, panic attacks, schizophrenia. So it is actually a brain disorder. It's not just simply being sad. So there's the biological imbalances that can occur in a person's brain, and then there are the psychological stressors, or people who will come to me and say, oh, well, I have a situational depression. That may be true, but that situation may have also progressed them to the point where they actually have a biological depression as well, where medications can be very helpful. So, I mean, I think it is important to know that there are not only biological and psychological factors that contribute to depression. When it comes to a treatment, there's also biological and psychological treatments. And, you know, the psychology of it, learning coping mechanisms, going to see a therapist or a counselor to learn how to deal with your issues better or how to think about things differently is certainly going to be very helpful. But medications and trying to restore some of the balances in the brain is going to be an important part of treatment as well.
Well, and one of the things the research shows is that the combination of the therapy and the medication together give you sort of the biggest bang for your buck in terms of improving mood and holding it stable over time for the reasons that you just said.